In the medieval world, war was constant, brutal, and deeply personal. Soldiers faced not just the blade of an enemy, but the far more persistent threat of surviving without the knowledge, tools, or resources that modern medicine provides. There were no sterile bandages, no antibiotics, no hospitals equipped to treat trauma. The battlefield was only the beginning of a long and often deadly struggle to stay alive. Every wound was a gamble, every infection a test of endurance, and every recovery a product of improvisation, traditional knowledge, and sheer resilience. From crude amputations performed by barber surgeons to battlefield first aid using herbs and alcohol, medieval warriors had to rely on instinct, Akan's amputations, and the collective memory of their cultures. Disease, poor nutrition, psychological strain, and chronic injury followed them off the field and into camp, home, or monastery. Yet, despite the overwhelming odds, many did survive. Not because the system was efficient, but because the human body, when supported even by the simplest interventions, could sometimes do what no science at the time could. Their survival wasn't the result of medicine as we know it, but of adaptation, belief, community, and the hard-earned lessons of countless generations who fought and endured. Number 1. Battlefield trauma and immediate survival. In the thick of medieval warfare, the moment a soldier was struck by a weapon, whether it was a war hammer caving in a helmet, an arrow piercing deep into muscle, or a broadsword slicing through bone, there was no organized medical team rushing in. Immediate survival came down to instinct, desperation, and the help of nearby comrades. On the battlefield, time was measured not in minutes, but in heartbeats. If a man fell and his injury wasn't instantly fatal, the main priority became stopping the bleeding. Soldiers were not trained medics, but centuries of accumulated battlefield experience gave them certain habits. Rags torn from tunics, bits of leather straps, moss scraped from rocks, or even cold mud were pressed into open wounds to slow the flow of blood. These materials were anything but clean, but the concept of sterility didn't exist. The logic was simple: bleeding to death was a far greater immediate threat than infection a week later. Spiderwebs were among the stranger remedies, wound-packing material used across different regions. Though it was used more out of availability than science, it turns out spider silk contains mild antiseptic properties and helps blood clotting. That wasn't known at the time, but its effectiveness led to its continued use. If the wound was on a limb, belts or strips of cloth were quickly tied above the injury site to act as makeshift tourniquets. This crude method restricted blood flow, buying time for the wounded man to be dragged from the fight. But even this carried risk. Leave the tourniquet too long and the limb died. Remove it too soon and bleeding resumed. There was no manual for this, just gut decisions made in the chaos of clashing steel and screams. Once out of direct combat, survival depended on the terrain and who was nearby. Knights had squires or servants who could help them off the field, but common foot soldiers relied on brothers in arms or pure luck. If dragged behind the lines, a soldier might have his wound wrapped tighter with anything from linen to horsehair. Sometimes hot coals or irons were pressed into the wound to cauterize it right there in the field. The process was agonizing, often done without restraint or sedation, but if successful, it could seal blood vessels and prevent further hemorrhage. Yet this was only done when someone had both the tools and enough nerve to hold down a screaming man. In many cases, soldiers simply collapsed where they were hit, especially if their comrades were still fighting. After a battle, wounded men were often left where they fell until the battle ended or scavengers arrived. If they were lucky, friendly forces returned for them. If not, enemy looters might finish them off or leave them to die slowly. Some survivors managed to crawl to safety. Others bled out over hours, suffering in silence among corpses and trampled earth. Every injury was a gamble. There was no such thing as medical certainty, only the body's stubborn will to live in whatever crude aid was possible in the moment. Number 2, pain, amputations, and the limits of medieval surgery. In the brutal reality of medieval warfare, pain was not something to be treated, it was something to survive. There were no effective anesthetics as we understand them today. The pain of an injury, and especially of a medical procedure, was immediate, violent, and often overwhelming. For the vast majority of wounded soldiers, pain management relied entirely on crude improvisation. Alcohol, usually in the form of strong ale, mead, or wine, was the most accessible option and used more to sedate the senses than to actually dull pain. It was poured down the throat before procedures or directly into open wounds as a primitive disinfectant, although its effect on bacteria was minimal. In some regions, particularly where knowledge from the Islamic world or classical texts persisted, more potent substances like opium poppy extracts or mandrake root were used as sedatives. However, such remedies were rarely available to ordinary soldiers and were mostly reserved for wealthy knights or those treated in monasteries or by well-educated physicians. Amputation was one of the few surgical responses available for severe limb injuries, especially when a wound was caused by crushing force, such as from a mace, or a deep infected cut that had gone gangrenous. Soldiers whose legs were shattered beneath horses, or who took sword blows that splintered bones, often had no other option if they wanted to survive. The idea wasn't to repair the body, but to prevent rot from spreading. The people performing amputations were rarely formally trained surgeons. In most cases, these procedures were carried out by barber surgeons, a profession that combined grooming with basic medical tasks. Their tools, knives, saws, clamps, were used for multiple patients, often without any cleaning between uses. This wasn't due to carelessness, but because the concept of microbial infection didn't yet exist in European medical thinking. Before the limb was cut, a tourniquet would be tied above the wound to minimize blood loss. The surgeon would then slice through the skin and muscle quickly with a sharp blade before using a saw to remove the bone. Speed was critical. The longer the procedure took, the more likely the patient was to die from shock or hemorrhaging. After the limb was severed, a heated iron rod was pressed against the open stump to cauterize it and seal the blood vessels. The pain of cauterization was unbearable, and patients often lost consciousness, sometimes from the trauma alone. If they didn't die from the operation itself, the following days were just as dangerous. Infection set in quickly, especially with exposed tissue, and no real method for cleaning or dressing wounds effectively. Despite these risks, some soldiers did survive amputation, particularly younger men in strong physical condition with access to better food and post-operative care. Occasionally, monasteries provided more structured recovery, with herbal treatments, quiet environments, and basic wound management, increasing the odds of survival. Still, the majority of soldiers who underwent amputation either succumbed to infection or were left permanently disabled and unable to return to battle. The process was as much about cutting away death as it was about preserving life. Pain was never eliminated, only endured with gritted teeth and the faint hope of recovery. Number 3, infection without understanding germs. In the medieval era, the concept of infection was filtered through a framework of oral theory, spiritual beliefs, and direct observation, but without any understanding of microbes or bacteria. Soldiers and healers didn't know that invisible organisms caused wounds to fester. They simply knew that some injuries turned sour, that pus could smell foul, and that fever often followed even minor cuts. They described this not in scientific terms, but with words like corruption, putrefaction, or the imbalance of humors, especially excess black bile or phlegm. When a wound oozed green or yellow, or when the skin turned red and hot to the touch, they interpreted it as nature reacting to imbalance or as divine punishment for sin. The lack of germ theory didn't mean they did nothing, they just fought it in ways that made sense to them, often combining practical remedies with symbolic ritual. One of the most effective treatments used without them realizing its value was raw honey. Applied to open wounds, it acted both as a sealant and, coincidentally, a mild antimicrobial agent. In modern terms, honey's low pH, hydrogen peroxide content, and natural enzymes inhibit bacterial growth. But in medieval thought, honey was valued more for its symbolic purity and warmth. It was used in monasteries, on battlefields, and in peasant homes alike. Another widely used remedy was garlic, ground into a thick paste and applied directly to injured tissue. Sometimes it was mixed with wine or vinegar, substances thought to purify or draw out the evil. Vinegar, especially wine vinegar, was considered especially valuable for cleansing because of its sour, acidic nature. While they had no sterile instruments or knowledge of antiseptics, the acidic environment created by vinegar may have helped reduce some microbial presence, though inconsistently and without control. They also used clay, ash, and even animal fat mixed with herbs to make poultices. These poultices were applied to deep wounds or boils in an attempt to pull out the rot. The idea was that infection was something that needed to be expelled from the body. Sometimes this meant applying warm compresses to encourage pus to surface. Other times it meant lancing the wound open with a knife or heated iron to drain it. Again, with no real sanitation, often leading to more complications. These procedures were dangerous but common, and they reveal an intuitive, if imprecise, grasp of drainage and the importance of removing dead tissue. Abscesses were sometimes left to burst naturally or were punctured using sharp tools that had been used on multiple people. In most cases, there was no hand washing, no boiling of instruments, and little regard for recontamination. Though some religious orders promoted washing hands before care as a matter of spiritual cleanliness, herbal medicine filled the gap left by ignorance of microbiology. Monastic scriptoria across Europe preserved herbal texts like Physica by Hildegard of Bingen, or remnants of Roman works by Galen and Dioscorides, which included references to plants now known to have antibacterial properties. Yarrow was used to stop bleeding and promote healing, thyme for its cleansing effect, and sage to reduce inflammation. These herbs were gathered by monks, nuns, and village healers, often applied in layered treatments where dried leaves were boiled, crushed, or steeped in oil. The knowledge wasn't centralized or systematized. Much of it passed orally, especially among women healers, midwives, and herbalists who operated outside of formal church-sanctioned medicine. During war campaigns, some women traveled with the army and provided unofficial care, blending folk knowledge with battlefield necessity. Their role was crucial, though often unrecognized in historical records. The fact that some soldiers survived horrific infections is a testament not to medieval medical science, but to the resilience of the human body, sheer luck, and occasional success from these rudimentary interventions. While many died from what today would be preventable complications, some lived long enough for their wounds to scar over. For every festering wound that ended in gangrene or death, there were a few that healed helped by herbs, time, or just a robust immune response. Their survival didn't come from understanding bacteria. It came from working around it with what they had, and relying on tradition,